Whooping cough, also called pertussis, is surrounded by myths and misinformation. Myth: whooping cough only affects children. Fact: anyone can get pertussis. In 2024, the majority of UK cases, nearly 59%, were in people aged 15 and older. Teens and adults often have milder symptoms, but can still spread it to babies who face the highest risk. Myth: if you're vaccinated once, you're protected for life. Fact: immunity fades over time. That's why boosters are recommended for adolescents, adults, and pregnant women. The vaccine doesn't eradicate pertussis completely, but makes illness far less severe and prevents deadly outcomes in infants. Myth: the whooping cough vaccine is dangerous. Fact: decades of evidence show the DTaP and DAP vaccines are safe. Side effects are usually mild, like arm soreness or fatigue.